morning, everyone. Welcome to the Tar Heel Open Enrollment for Plan Year 2022. I'm Taryn Brandon. I have my co-host here with me, Vincent Berry. And we're going to talk to you this morning about some of the changes that's going on with Open Enrollment 2022 with your state health plan, your NC Flex plans, and some UNC benefit plans as well. During this presentation, if you have any questions, please email us at benefits@unc.edu. Even if you have questions after the presentation, we look forward to your questions and we will respond to you either during this presentation or after the presentation. So yes, it's that time again, time of year again for you as an employee of UNC Chapel Hill to review your current benefit plans and decide which plans are going to best serve you in the upcoming plan year. So this is our agenda today. We're going to talk to you about the dates, the very important dates that you have to make your decision. Of course, we want to assist you in preparing and deciding and moving forward and choosing your benefit plans for the upcoming plan year. We're going to talk to you a little bit about some changes in available benefits this year and provide resources where you can get assistance for your open enrollment. We will give you the website where you can find the step-by-step instructions on how to enroll in your benefits this year. So the open enrollment dates, the very important dates, are October 11th through the 29th of this year for the 2022 plan year. So be mindful of these dates. These are the dates in which you have to make a decision about your benefit plans for next year and ultimately enroll in the plans that you want. The enrollment window will close on October 29th at midnight. So we want you to be aware of that. So to get you prepared, we sent information to you. If you have not received any flyers, you should be receiving some soon from the UNC Benefits Office, as well as the NC State Health Plan and NC Flex as well. So please review your materials so you can get prepared to make those most important decisions for Plan Year 2022. So we want you to get prepared, and how to do that is, again, read your correspondence. You should receive emails. You may receive flyers and postcards from the UNC Benefits Office, the UNC Chapel Hill, as well as the NC State Health Plan. If you have not received any documentation, you should be receiving some shortly. And just reach out to our office if you haven't, okay? We want you to know and understand your choices and compare your plan options so that you can know which benefits are going to best suit your needs in the upcoming year. And of course, we want you to know what your out-of-pocket costs will be to enroll in these benefits. So we want you to go beyond health insurance. Most people think that when I'm thinking about benefits, I'm simply thinking about my life insurance, or we want you to think about your life insurance as well. Do you have any expenses that you anticipate this year? So you maybe want to think about enrolling in a flexible spending account. We'll talk about those. And of course, we want you to ensure that if you are enrolled in any life insurance plan or AD&D plans or any plans that requires a benefit if something should happen to you, we want you to make sure that you have those benefits going to the persons that you choose. So please update your beneficiaries on all of your plans this year. Be sure to do that. So your enrollment is going to require your action this year. You can enroll through Connect Carolina. Again, I will provide you the website where you can find the step-by-step instructions on how to enroll in your benefit plans this year. You want to ensure when you are enrolling that you always hit the save button so that your elections are not lost and they're saved. And then at the end of your enrollment, please print your confirmation statement. This may be beneficial to you going forward. If you see at the end of December that your deductions are not coming out for the benefits that you elected this year, your confirmation statement will be proof that you actually enrolled in those plans. So make sure you print those out and save those somewhere so that you will have access to those. So your action, yes, if you are a current participant in the North Carolina Healthcare Plan, you are automatically defaulted to the 70/30 PPO plan. So for those of you who say, okay, that's great, I want to remain in the 70/30 PPO plan, you still need to log into your Connect Carolina e-benefits portal and attest to your tobacco attestation. It's going to save you a lot of money each month. So make sure if you plan to stay in the 70/30 PPO plan that you log in and attest that you do or do not use tobacco products, okay? If you want to remain in the 80/20 plan, you must log into your Connect Carolina e-benefits portal and elect the 80/20 plan. Even if you're currently on the 80/20 plan, remember that you're going to be automatically defaulted to the 70/30 plan. So you must take action, log in, and re-enroll in the 80/20 PPO plan. If you are currently participating in either the flexible healthcare flexible spending account or the dependent daycare flexible spending account, your enrollment does not move forward into the upcoming plan year. So if you want to continue making contributions in these plans, you must re-enroll in these plans. So again, you must re-enroll in the 80/20 plan if you want to continue that plan. And if you want to continue contributing to either of the flexible spending accounts, you must re-enroll in that plan as well. All the other plans that you are currently enrolled in will move forward into the 2022 plan year. However, if you want to make changes to those plans, you will need to log in and take action on those as well. We want to remind you that if you are adding dependents to any of your plans, you must upload verification documents when adding dependents. We will provide you the website where you can find a list that's approved by the North Carolina State Health Plan as supporting documentation, okay? So for those who said, I do use tobacco products, do I have to take action? Yes, you can still lower your premium by $60 a month just by agreeing to participate in a tobacco cessation session. And you can do this by attending a one-time counseling session, counseling session with the CVS Mini Clinic, or a primary care provider. You can, the primary care provider is added to this year. Usually we only have the CVS Mini Clinic provided for you to do your tobacco cessation session. However, this year, the North Carolina State Health Plan has added another resource for you to complete your tobacco cessation session, and that is with any primary care provider. And by the way, that cessation session is free if you go to any CVS Mini Clinic or a provider that provide these services, okay? So you must log in first to attest that you do or do not use tobacco products. And if you do, then you must complete your tobacco cessation session by visiting a CVS Mini Clinic or a primary care provider. So you have until October 29th to attest that you do or do not use tobacco products. So if you attest that you do use tobacco products, you have actually until November 30th to actually complete your tobacco cessation session or your counseling session with the CVS Mini Clinic or a primary care provider, okay? The North Carolina State Health Plan will not be granting exceptions this year for those who do not live near a CVS. And the reason for that is because now they have given you an additional resource in the primary care provider so that you can complete your tobacco cessation counseling session with a primary care provider. Okay. The North Carolina State Health Plan will be tracking these completions or cessation session completions through the claims process. So what does that mean? When you actually visit a primary care provider or you visit the CVS Minute Clinic, please use your office visit summary, upload your document to the e-benefits portal through Connect Carolina, and that way you will have proof that you actually completed your cessation session. So in the future, the North Carolina State Health Plan does not have you as completing a cessation session, this will be your proof that you actually completed your session. Okay. Now, for those who are hired after open enrollment closes, they will have the standard 90 days to complete their tobacco cessation session. Those who have completed those tobacco cessation sessions will receive letters from the North Carolina State Health Plan weekly, notifying them that they have received their credit for their tobacco cessation session. So again, if you do not receive one of those letters, be sure that you upload your visit summary to the document center of the Connect Carolina e-benefits portal. So there's some good news and there's some not so good news. The good news is that most of our plans this year has no premium rate increase. There's no premium rate increase for the majority of our plans. However, there are some increases for the premium rates on the dental plan. The classic option and the low option dental plans, their premiums move back to the premiums that were in effect in 2020. Okay. However, the high option dental plan has increased. So if you can refer back, if you were here in 2020, and you can refer back to what the classic option and the low option premiums were, they simply move back to those options, and the high option has increased for this year. So there have been a lot of significant changes with the healthcare flexible spending accounts this year. The Consolidated Appropriations Act of 2021, in response to COVID-19 pandemic, has made some changes that they feel will benefit the employees on the healthcare and the healthcare flexible spending account, as well as the dependent daycare flexible spending account. And we will talk about some of those changes. But to start with the healthcare flexible spending account, the annual maximum election for this year for 2022 is $2,750 per employee. So what does that mean? If I have a spouse who also works for the state of North Carolina, both me and my spouse can contribute up to $2,750 for the upcoming plan year. There's a minimum amount, which is $120. So you must you cannot contribute any less than $120 per month, but no more than $2,750 per month. Okay. So the annual rollover amount for 2021 going into 2022 is there's no cap on the annual enrollment rollover amount. However, nothing over less than $25 will roll over. So you must have a minimum of $25 in your account for it to roll over, but there's no cap on what can roll over into the 2022 plan year. Okay. So that means that even if you have funds that's left in your 2020 account, anything $25 or more in your 2020 account, those funds will also roll over into 2022. Okay. The rollover amount from 2020 22 to 2023, of course, will revert back to the original $550. But again, your 2020 and 2021 funds from your healthcare flexible spending account will roll over into plan year 2022. You do not have to re-enroll to use those funds. However, if you want to continue contributing to the healthcare flexible spending account, you will need to re-enroll to have your deductions taken out. Okay. So here are some of the highlights for the healthcare flexible spending account. Of course, P&A Group will not allow employees to use current funds for prior year expenses. So for example, if you have deductions from 2021, if you have plans, if you have funds in your 2021 account, you cannot use those funds to pay for expenses that were incurred in 2020. So that's what that means. So if you try to do that, P&A will freeze your account and they will not reopen your account until the money or the funds are paid back, or you file a current claim that will be equal to or more than what was owed on your previous claim. Okay. So the Consolidated Appropriations Act extended some run out periods for the funds that are left in your healthcare flexible spending account. So run out period just means the last day that you can file claims for those funds that are in those accounts. So if you have funds that are left in your 2020 healthcare flexible spending account, you have until April 30th of 2022 to use those funds. So for your 2020 funds, your claims, your expenses must have been incurred between January and December 31st of 2020. But you still have until April 30th to actually file a claim against those expenses. For the 2021 and 2022 plan year, you have until March 31st of 2023 to actually file claims against those expenses. But of course, the expenses have to have been incurred in that plan year. So for example, if you are filing a claim for 2021, the expenses that you file those claims for must have been incurred between January and December 31st of this year. But you still have until March 31 of 2023 to file a claim on those expenses. Yeah. So for the daycare flexible spending account, the annual maximum election amount is $5,000 per household. Unlike the healthcare flexible spending account, this amount is per household. So if I have a spouse who also works for the state of North Carolina, we can only contribute up to $5,000 as a family, not as individuals. Okay. So if any employee wanted to make changes or wants to make changes mid-year with their daycare flexible spending account, they can do so as a daycare change, or that is considered a life event. Okay. Services incurred after separation. If you are separating or terminating from the university and you have funds available in your dependent daycare flexible spending account, you can be reimbursed up to the balance that's in your account, not the contribution amount that you set aside, but whatever is left in your, whatever funds are that are actually in your dependent daycare flexible spending account, you can be reimbursed for those if you are terminating employment from the university. So the dependent daycare flexible spending account, while it does not have a what you call a rollover, You cannot roll those funds over into the next year. However, the Consolidated Appropriations Act have implemented what they call a grace period for your daycare flexible spending account funds. And a grace period is just simply the time that you have to incur expenses for that account. So, for example, on your 2020 account, you can incur expenses all the way through the end of this year, through December 31st, for your 2020 account, and use your funds for your 2020 account to pay for those or file claims on those expenses with the daycare flexible spending account. And the grace period for the 2021 account has been extended to December of next year. So that means that you have until December 31st of next year to incur expenses for your 2021 account, daycare flexible spending account. So like the healthcare flexible spending account, the daycare flexible spending account does have run out periods. And that just simply means the last day that you can file a claim against your account. The run out period for the 2020 funds in your daycare flexible spending account is April 30th of 2022. So that means any expenses that you have incurred from January of 2020 to December 31st of this year, you have until April 30th to file claims against those expenses. For the 2021 and 2022 accounts, the run out period for those accounts will be March 31st of 2023. So that means that you have until March 31st of 2023 to file claims on expenses you incurred from January of 2021 to December of 2022 for your 2021 funds. And for you have until March 31st, 2023 to file claims on those expenses that you incur in 2022 through the end of 2023, which is your 2022 account. Okay. The run out periods, simply they just hold rollover funds until you are ready to file expenses on those funds. P&A will use your current year funds for current year expenses prior to your rollover funds being used. So if you file a claim in the current year, they're going to pull from those funds. And even though you have that period where you can incur those expenses, they are going to pull from your current year's expenses first before they start pulling funds from your rollover funds. Next slide. So you cannot, on the healthcare flexible spending account or the daycare flexible spending accounts, you cannot prepay for services and get reimbursed or file a claim. So what does that mean? Sometimes, for example, if maybe you are getting orthodontic treatment and your orthodontist tells you that if you prepay everything up front, you will incur a lesser cost or pay less than you would if you extend your payments out. Well, you can do that if you do not file those expenses against your healthcare flexible spending account. And the reason is because P&A says that they can cross over into plan years. And again, they only use, you can only use the current plan years funds for those current expenses. And so that's why they tell you cannot prepay for your services and then file a claim on your flexible spending account. Okay. So again, I talked about how changes can be made in the middle of the year with a valid life event. Some examples of a healthcare flexible spending account valid life event are the typical ones: marriage, birth, adoption, and the death of a dependent. Some of the life events for the dependent daycare flexible spending account is For example, if you, during COVID, if your daycare was shut down because of COVID, that stop is a life event, so you could stop your contributions because of that. And then now that your daycare is starting, many daycares are opening up again, that is also a life event, so you can start your contributions based on that life event. So what happens if I terminate my employment? What happens with the funds in my healthcare flexible spending account and my daycare flexible spending account? So with your daycare flexible spending account, if you terminate employment and you have funds that are left in your dependent daycare flexible spending account, you can use those funds in your account for the expenses incurred through the end of the plan year. And that goes back to those plan years or those grace periods that we talked about earlier. However, you cannot continue your dependent daycare flexible spending account through COBRA. That is not an option. You can only use those funds for the expenses that were incurred through the year, but you can't continue contributing to the dependent daycare flexible spending account through COBRA. However, with the healthcare flexible spending account, if you leave employment and you have funds in your account, you can, those funds will be forfeited unless you continue your coverage through COBRA. So you can continue your coverage with the healthcare flexible spending account through COBRA. So what happens if I've used all my funds for my healthcare flexible spending account, but I have not contributed to of that total amount? Do I have to pay back that money? Absolutely not. You do not. So if you are terminating employment and you have used all your funds in your healthcare flexible spending account, but you have not contributed, those funds are just forfeited and we will not ask you for that money back. Okay. So if anyone is planning to retire on January 1st, we recommend, if you have funds in your healthcare flexible spending account, that you do choose the COBRA options. That way you will be able to use your funds up to 18 months under COBRA, and those funds will not be forfeited. So there's some things, that important points that we want you to remember while you are going through your enrollment process. One is make sure that you save your choices at the end of each enrollment. For example, if you elect the 80-20 plan, make sure you save those. If you go in to do your tobacco attestation, make sure you click save at the end of that enrollment. And we also encourage you, ask that you print out your confirmation statement, because like I said, at the end of December, in December is when your deductions will come out. Most of your deduction will come out for your January election or your January choices. So if you do not see those deductions in your December pay, then your confirmation statement is proof that you actually enrolled in the benefits that you wanted. So if we have to go in to do an exception process for you to get your benefits caught up to date, your confirmation statement will be the proof that we will need to do that. So make sure that you print those out, okay? So members that call into the call center to complete their enrollment, for example, if you call into the North Carolina State Health Plan Eligibility and Enrollment Center, in the past, they would send an email confirmation statement out to those employees so that they will have proof that they actually enrolled in those plans. The North Carolina State Health Plan will not be sending out email confirmation statements. So what we recommend that you do is, once you enroll with the Eligibility and Enrollment Center, log into your Connect Carolina eBenefits account and print out that confirmation statement. You can still print out your confirmation statement through your Connect Carolina portal, okay? Please, please, please check your address in Connect Carolina and make sure it is correct, especially if you're planning to receive medical ID cards. because all correspondence from the North Carolina State Health Plan will be sent to that address of record that you have, your home address of record that you have listed in Connect, Carolina. Unfortunately, correspondence cannot be sent to your mailing address or your business address that is listed in Connect, Carolina. They can only be sent to your home address. So make sure that you check your home address in Connect, Carolina so that you can receive the documents that you need to receive. Okay. So we, of course, are resources for you. If you need assistance or if you just need to ask questions about your open enrollment, you can find our benefits, information about our benefits plans, as well as how to enroll. Remember, I talked about that step-by-step instruction earlier. You can find that and other information about our benefit plan on our website. Just go to hr.unc.edu/benefits/enrollment, and there is a lot of information out there. So please check us out. If you want to talk to a consultant, ask consultants about your open enrollment benefit options or how to enroll, or just have questions during this time, you can sign up for a Zoom session with a consultant. You can find that link on our website as well. And you can also call our Benefits and Leave Admin Support Center to answer we are here to answer your questions and to assist you in your open enrollment process. Just give us a call at 919-962-3071. Other resources, you can always contact the North Carolina State Health Plan to help you or to assist you in your enrollment process as well. Just remember that if you call the North Carolina State Health Plan, there may be long waiting periods. So if you want to utilize them, I ask that you pack your patience. And what I ask that you don't wait till the last day to try to contact the North Carolina State Health Plan, because that's when they are the busiest. So it may take some time for them to get to you or to answer your call. Other resources, as I stated earlier, you should have, if you haven't already, you should be receiving some postcards from UNC Chapel Hill, some mailers. Of course, you have our website that we have a lot of great information there, and webinars with the state of North Carolina, as well as the webinar that we presented here today. So we implore you to, if you have any areas or system glitches during open enrollment, to call the eligibility and enrollment hotline at the North Carolina State Health Plan. That's why we ask that you not wait until the last day or the last hour to try to enroll, because in the past we have experienced these kinds of errors, and we want you to make sure that you get those benefit choices that you want for the upcoming plan year. So with that, we will entertain any questions that you have on the open enrollment or any benefit plans that we have. You can send those questions to our email at benefits@unc.edu. We're waiting to hear from you.